I'm Cordelia Miller-Muhammed, and I work for the Counseling Center of Lakeview as a clinical project director for one of the programs that we were funded through SAMHSA to serve homeless adolescents. And I guess I came to the training today of trainers because I really believe that the client directive outcome informed service delivery system is really important. The mission of our agency is that we actually try to serve the marginalized population. And I saw where this particular style of service delivery would give them power, empower them, and give them a voice. But also, I am in the state of Illinois, and we're broke right now. And so community mental health agencies like mine are suffering. We're a small community mental health agency that's strong with values and is the love for people or those who are struggling, who do not have resources. And we want to stay alive. We want to be able to continue to provide services. I believe that if we can incorporate this approach into the way that we service our population, we will continue with our legacy, and we will continue to be able to make a difference in the lives of those who have mental health challenges.
You know, Cordelia, you work with a dedicated group that has strong values. No one's getting rich at your agency.
No.
And you're working with kids that might not be seen in traditional treatment settings.
Exactly.
What kinds of challenges are you seeing amongst the kids that you work with?
Well, one of the hugest challenges is that our youth are not able to connect in your traditional service delivery systems. And so because they have a lot of trauma that they experience and they do not have access to supportive resources and lack the skills and even being able to create those kinds of support networks for themselves because they've been surviving. Then we find that we have to totally change the way that we work with them. Now, in my program, we've been successful in changing that way. We have a waiting list of youth who want services, but I have not in the past been able to show scientifically how what we does work until I found CDOI.
And so we've got clients who are not traditional kinds of folks.
Exactly.
Not being seen in traditional mental health settings.
Exactly.
But they want something.
Yes.
They want help. Was there something in the CDOI message, some nugget that made you think, aha, this might help us bridge that gap with the people we work with?
Most definitely, and it was the culture of feedback.
Okay.
Another evidence-based practice we're working with is called the sanctuary model, and we've struggled in our collaborative in trying to roll that model out and get the line staff to actually implement what it takes to make the culture safe. If we can bring in this way of creating a culture of feedback where we have our recipient of services voicing what works for them, then everyone gets comfortable with being honest and truthful, and then we actually create what I consider a team that works for the betterment of everybody, opposed to maybe having recipients who's too afraid to speak up because they're thinking of the traditional way that services have been provided, which is from the expert to those who don't know what's going on.
Together we can solve this problem.
Oh yeah, exactly.
Thanks, Cordelia.
No problem.
Thank you very much.